Hello, and thank you for joining me. As we get older, taking care of ourselves, well, it really becomes one of the most important things we do, doesn't it? Today, I'd like for us to have a nice, calm chat about something that's probably in your home right now, the medicine cabinet. Now, just think about that for a second. It's a bit of a surprising question, right? I mean, we spend so much time trying to eat well, trying to stay active, and it's just possible we might not be looking closely at the very things we take to help us feel better. And I want to be really, really clear about something right from the get-go. This is not about making you feel worried, not one bit. The whole point of our chat today is just to share a little information, to empower you, so you can feel even more in charge of your health. It's all about helping you be a great partner with your doctor. Okay, shall we begin?
All right, let's start with number 5. Now, this is something I'm sure most of us have in our homes, for that nagging backache or when the arthritis acts up, or even just for a headache. But as our bodies get a little older, a little wiser, even these common everyday helpers, well, they deserve a second look.
So on the one hand, these familiar pain relievers, things like ibuprofen, they do a fantastic job. They can be a real lifesaver for our aches and pains. But there's another side to the story. For our bodies, especially as we age, these same pills can sometimes tell our kidneys to hang on to a little extra salt and water. And that extra fluid, well, it can put a quiet but steady strain on the heart over time.
Now here's the thing that's so important to see. The signs can be really subtle, and it's so easy to just brush them off, isn't it? Maybe you notice your shoes feel a bit tighter, or your ankles look a little puffy. Maybe your legs just feel heavy, or you're just more tired than usual. It's the easiest thing in the world to say, oh, that's just me getting older. But every now and then, it might actually be a little signal your body is sending.
So the bottom line is this. You absolutely should not have to live with pain. Of course not. The whole idea is to find a way to manage that pain without accidentally creating a new problem down the road. And you know what? A lot of the time, just a simple chat with your doctor can open up all sorts of other options that might be a much better fit for you right now.
Okay, on to number 4. And this one is about something we all cherish, don't we? A good, peaceful night's sleep. Or just a moment of calm when things feel a little overwhelming. And the pills that help us get there, well, they can feel like a real blessing. But they have another side that's really important for us to understand.
So these medications work by kind of hushing the busy parts of our brain, and that's what lets us relax and finally fall asleep. But in a body that's been around a bit longer, that calming effect can sometimes stick around. It can make us a little slower to react, and really importantly, it can affect our balance. Just think about getting up in the middle of the night. It's dark, you're sleepy, that's exactly when you want to feel steadiest.
And just like before, the clues can be so easy to miss. Maybe you feel a bit foggy, not quite as sharp as usual. Or you're a little more forgetful. Maybe you just feel a bit unsteady on your feet. It's completely natural to chalk that up to getting older, but it's always a good idea to just wonder, could one of my pills be part of this?
Okay, now this next part is so important. So please listen closely. You should never, ever stop taking these kinds of medications on your own. Just don't do it. Your body gets used to them, and stopping all at once can be really unsafe. The only safe way to make a change is to do it slowly, with a careful plan that you and your doctor come up with together. They know exactly how to guide you through it safely.
All right, coming in at number 3, we're going to talk about a little pill that millions and millions of people take every single day for heartburn. That uncomfortable feeling? And when you have it, these pills can feel like an absolute miracle.
So these pills, they're brilliant at what they do. They reduce the acid in your stomach, and boy, does that bring relief. But here's the hidden part. That stomach acid, it actually has another really important job. It helps your body pull all the good stuff out of your food. Nutrients like calcium for your bones or magnesium for your heart and muscles. And if we lower that acid for a really long time, we might be making it harder for our bodies to get those building blocks it needs.
And this is where you can see how one thing can lead to another. If you're not absorbing enough calcium, over time, your bones can get weaker. Not enough magnesium, and it can mess with your heart's rhythm. And not getting enough B12, well, that can make you feel tired and foggy. And what do all those things sound like? Yep, things we often just say are a normal part of getting older. And here's the key. Most of these pills were really meant to be used for a short time, a few weeks, maybe a couple of months. But because they work so well, it's just so easy to keep taking them. And before you know it, years have gone by. That's why it's such a good idea to just check in with your doctor and ask that simple question, do I still really need to be taking this one every day?
Okay, number 2. This one might come as a little bit of a surprise. We're going to talk about the very medications that are designed to protect our hearts, things like blood pressure pills.
Now, these are absolutely life-saving medicines. There's no question about that. But they also need a little extra attention as time goes on.
This really says it all, doesn't it? A medicine that's been helping you for years might start to cause little problems if the dose isn't quite right for the person you are today. What was perfect for you at age 60 might just be a little too much at age 80.
Let me give you a couple of quick examples. You know those water pills? They're fantastic for reducing fluid. But if they do their job a little too well, you can get dehydrated, and that's what makes you feel dizzy when you stand up. Or how about beta blockers? They're meant to slow your heart rate down, which is good. But if they slow it down too much, well, then you might start feeling really tired or short of breath.
And that's really the main point here. Our bodies are amazing, and they're always changing. How our kidneys work, our circulation, it all changes as we get older. And because of those natural shifts, sometimes the dose of a medicine just needs a little tweak, a little adjustment to make sure it's still the perfect fit for you.
And here we are. We've arrived at number 1. Now, this one isn't about a single type of pill. It's about a bigger idea. And honestly, it might just be the most important thing we talk about today for your health and your peace of mind. So, after all of this, you might be wondering, what is the most dangerous pill of all? What could it be?
The biggest risk, well, it isn't actually one pill. It's all the pills, together. There's a medical term for it, polypharmacy, and all that means is taking 5 or more different medications every single day. You see, the real danger isn't in any one of those pills by itself. It's in the way they can all mix together inside your body, creating a kind of chemical soup that can have some unexpected effects.
Now, if you're listening to this and thinking, that's me, I want you to know you are not alone. Not at all. This is so common. In fact, almost half of all folks over 65 are taking 5 or more pills every day. And you can see how it happens, right? There's one for blood pressure, one for cholesterol, maybe one for your arthritis, another for heartburn. They just add up over time.
But here's the best part. There is a very simple, very powerful thing you can do about it. It's called a medication review. It sounds fancy, but it's easy. Here's all you do. 1. Make a list of everything you take. I mean everything. Prescriptions, vitamins, anything you buy at the drugstore. 2. Make an appointment with your doctor just to talk about that list. 3. Go through it together, one by one, and ask, do I still need this one? Is it still helping? And 4. Together, you and your doctor can come up with a simpler, safer plan. That's it.
So when you boil it all down, it comes back to one simple thing. This isn't about you making big, scary decisions all by yourself. It's just about starting a conversation. It's about feeling empowered. Because you know, sometimes that one little chat with your doctor, it can help you feel better, think more clearly, and best of all, it can give you a wonderful, wonderful sense of peace of mind. And you certainly deserve that. Thank you so much for spending this time with me.